If you are over 60, I want you to pay very close attention to what I'm about to say. Because right now, your legs may already be losing healthy blood flow, and you might not even feel it clearly yet. Maybe your legs feel heavier than they used to. Maybe you notice a strange numbness when you sit too long, or you stand up and feel slightly off balance for a moment. You might even feel your feet staying cold, even when the room is warm. Most people brush these things off. They say, that's just age catching up. But I need to be honest with you, that is not the full story. What you are feeling is often your circulation quietly slowing down. It happens little by little, over years. And because it is gradual, it feels normal. Until one day, it starts limiting how far you can walk, how long you can stand, or how steady you feel. Now here's the part most people never hear. There are specific natural oils that, when used the right way and at the right time, can begin supporting your blood flow faster than you might expect. Not overnight miracles, but real, measurable changes inside your body. And even more important, there is one simple combination used in the morning that can make these effects noticeably stronger. Stay with me, because what I'm going to share today could change how your legs feel starting sooner than you think. Before we go any further, let me take a moment to introduce myself and explain why this conversation is so important for you. My name is Dr. Gregory Allen. For more than 10 years, I've worked with older adults who are struggling with circulation, especially in the legs. I've seen people who thought they were simply slowing down with age, when in reality, their blood flow had been gradually declining for years. And here's something I want you to understand clearly. Most people do not notice circulation problems when they begin. The body is very good at adapting. It compensates quietly until one day the symptoms become hard to ignore. Everything I'm sharing with you today is based on clinical research and real patient outcomes. These are patterns we see consistently, not rare cases. Now let me ask you something simple. Which one describes you best right now? Do you feel lightheaded when you stand up? Do your feet feel cold even when others are comfortable? Or do your legs feel heavy and tired by the end of the day? Just one of these is enough to tell us something important about how your blood is moving through your body. And as we continue, you'll start to see exactly what your body has been trying to tell you. Now let's talk about what is really happening inside your body in a way that is simple and clear. Poor circulation does not appear suddenly. It builds slowly, over many years. In fact, most people begin losing healthy blood flow long before they ever feel a symptom. Inside your blood vessels, something gradual is taking place. Think of your arteries like flexible tubes that carry blood to your legs. When you're younger, those tubes are smooth, open, and responsive. Blood moves through them easily. But over time, small changes begin to happen. Inflammation starts to build along the inner walls. This is a quiet process. You don't feel it, but it slowly irritates the lining of your vessels. Then, tiny deposits begin to stick to those walls. These deposits narrow the space where blood flows, just like a pipe slowly getting clogged. At the same time, the muscles in the vessel walls lose flexibility. They no longer relax the way they used to. Normally, your body produces a natural signal that tells your blood vessels to open wider when needed. That signal becomes weaker as you age. So now you have three things happening together: narrower pathways, stiffer vessel walls, and a weaker signal to open them. When that happens, blood cannot move as freely as before. And your legs, being the farthest point from your heart, are often the first place where you begin to feel the difference. Now, let's connect what we just talked about to what you may be feeling in your own body. When blood flow slows down, your legs do not receive the oxygen and nutrients they need at the right time. And that is when the symptoms begin to show up in ways that seem small at first. You might notice that after a short walk, your legs feel unusually heavy. Not pain exactly, just a deep, tired feeling that wasn't there years ago. Your feet may stay cold, even when the room is warm and comfortable. You put on socks, maybe even 2 pairs, and still that cold feeling doesn't fully go away. By the afternoon, your legs may feel more fatigued than they should. And at night, when your body is resting and circulation naturally slows, you might experience cramping or discomfort that wakes you up. There is a medical term for this pattern. It is called peripheral artery disease. Many people have it without knowing. In fact, Millions of adults over 60 are affected, and a large number never receive a diagnosis. Because the truth is simple, these symptoms are often dismissed as normal aging. But when they appear regularly, they're your body's way of telling you that your circulation needs attention now, not later. Now here's the part that gives many people a sense of relief. Even though these changes inside your blood vessels take years to develop, there are still ways to support your circulation starting today. You are not stuck with this. Your body is still responsive. It simply needs the right signals. And this is where many people get confused. They think the only option is medication, or they believe nothing natural can make a real difference. But that is not entirely true. There are certain nutritional elements that directly influence how your blood vessels behave. They can support the natural processes your body already uses, like reducing inflammation, helping vessels relax, and allowing blood to flow more freely. Today, I'm going to walk you through 5 specific oils that have been studied for their effect on circulation, especially in adults over 60. Each one works in a slightly different way. Some help your blood vessels open more easily. Some reduce the internal irritation that narrows those vessels. Others help your blood move with less resistance. And when used together, in a simple routine, they can support your circulation in a more complete and balanced way. Let's start with the first one. Let's begin with the first oil, and this one might already be sitting in your kitchen right now. Extra virgin olive oil. Most people use it for cooking or flavor, but very few understand how powerful it can be for your blood vessels when used the right way. Inside this oil are natural compounds that directly support circulation. One of them helps reduce the kind of cholesterol that tends to stick to artery walls. Over time, that sticky buildup is what narrows the path your blood has to travel. But there is something even more important. Extra virgin olive oil also helps your body produce a natural signal that tells your blood vessels to relax and open. Think of it like gently widening a road so traffic can move more freely. As we get older, the body produces less of this signal. That is one reason circulation becomes less efficient with age. Now here is where many people make a mistake. Not all olive oil is the same. The benefits we are talking about come specifically from extra virgin olive oil, the kind that is less processed. It usually has a slightly bold, peppery taste at the back of your throat. That sensation is actually a sign of its active compounds. And how you use it matters just as much. Heating it too much can reduce those beneficial compounds. So the simplest way is to use it raw. Drizzle it over your food, add it to a salad, or take a spoonful with a meal. A small daily amount, used consistently, can begin supporting your blood vessels in a very natural way. Now let's move to the second oil, and this one works in a different but equally important way. Fish oil. If olive oil helps your blood vessels open more easily, fish oil focuses on something deeper, the inflammation inside those vessels. As we get older, a low level of inflammation tends to build up quietly in the body. You don't feel it directly, but over time, it affects how your blood moves. It makes the inner lining of your vessels less smooth, less responsive. Fish oil contains what we call omega-3 fatty acids. You don't need to remember the name. Just think of them as nutrients that help calm down that internal irritation. When that irritation goes down, several things start to improve. Your blood becomes less likely to clump together. Your red blood cells become more flexible, so they can move through smaller pathways more easily. And your vessels respond better when your body tells them to relax. In simple terms, everything flows more smoothly. Now here is something very important. Fish oil and olive oil do not do the same job. They work on different parts of the same system. One helps open the pathway. The other helps clean and calm the pathway. And when you use them together, their effects support each other. That is why many people begin to notice better results when both are included as part of a daily routine, rather than relying on just one alone. Now, let me share something that most people never hear, but it can make a real difference in how quickly you begin to notice changes. It's not just about using the right oils. It's also about using them at the right time and in the right combination. When you take extra virgin olive oil and fish oil together in the morning, something interesting happens inside your body. They begin to support each other. Olive oil helps your blood vessels open more easily. Fish oil helps calm the irritation inside those vessels and improves how your blood moves through them. When both actions happen at the same time, the overall effect becomes stronger than either one on its own. Think of it like this. One oil is gently widening the road. The other is making sure traffic flows smoothly on that road. When both happen together, movement becomes easier and more efficient. Morning is the best time for this combination because your body is coming out of a resting state. Your circulation is starting to pick up again. Giving your body these two signals early in the day helps set the tone for better blood flow over the hours that follow. A simple approach is enough. A small amount of olive oil with your breakfast, along with fish oil, either from a supplement or from a serving of fatty fish. It doesn't need to be complicated. What matters is consistency. And over time, this simple morning habit can begin supporting your circulation in a steady and noticeable way. Now let's talk about the third oil, and this is one that often surprises people. Black seed oil. In many parts of the world, this oil has been used for generations, but in recent years, researchers have started to look more closely at how it affects the body, especially the blood vessels. What they found is quite interesting. Black seed oil contains a natural compound that works on your circulation in several ways at the same time, and this is what makes it stand out. First, it helps calm inflammation inside your blood vessels, similar to what we discussed with fish oil. When that irritation goes down, the inner lining of your vessels can function more normally again. Second, it supports the same natural signal we talked about earlier, the one that tells your blood vessels to relax and open. So again, you are helping your body improve blood flow without forcing it, just guiding it. And third, it helps reduce the tendency of your blood to form tiny clumps. These small clumps can slow circulation, especially in the smaller vessels in your legs and feet. So instead of working in just one way, black seed oil supports circulation from multiple angles at once. For someone over 60, this can be especially helpful because circulation problems are rarely caused by just one issue. It is usually a combination of factors building up over time. Using a small daily amount, either in capsule form or as a measured oil, is often the simplest way to include it in your routine. Now let's move to the fourth oil, and this one is very different from the others. Because this oil is not something you take by mouth. This is castor oil, and it works from the outside, directly on your legs. Most people never connect something like this to circulation, but when used the right way, it can make a noticeable difference, especially in how your legs feel at the end of the day. Castor oil has a thick, rich texture, and it contains a fatty acid that can move through the skin more deeply than many other oils. When you apply it with gentle pressure, something important begins to happen. You are not just moisturizing the skin. You are helping stimulate blood flow in the small vessels just beneath the surface. These tiny pathways are often the first to slow down as circulation declines with age. Now here is where the technique matters. Instead of rubbing randomly, you want to move your hands upward, from your feet towards your knees. This direction supports the natural return of blood back towards your heart. Think of it as gently guiding the flow in the right direction. Spending a few minutes on each leg, using slow and steady strokes, can help your legs feel warmer, lighter, and less tense. Many people notice this change within a short time after applying it. The best time to do this is in the evening, before bed. It gives your body time to relax and allows the oil to stay in place longer. It's a simple habit, but when done consistently, it can support your circulation in a very direct and physical way. Now we come to the final oil on this list, and this one stands out for a very specific reason. Flaxseed oil. Among everything we've talked about so far, this is the one that tends to produce the fastest noticeable changes for many people, especially when it comes to how the legs feel day to day. Let me explain why in a simple way. Your blood is not just liquid, it has thickness to it. When it becomes slightly thicker, even by a small amount, it has to work harder to move through your vessels, especially if those vessels are already narrower than they used to be. Flaxseed oil helps address this. It contains a plant-based omega-3 that supports your blood in becoming less dense, more fluid. And when your blood flows more easily, it can travel through those tighter pathways with less resistance. Think of it like this. If you pour thick liquid through a narrow tube, it moves slowly. But if that liquid becomes lighter and smoother, it passes through much more easily. That is what you are helping your body do. In addition to that, flaxseed oil also supports a reduction in the internal factors that make blood more likely to clot or slow down. So you are not only improving flow, you are also making that flow more stable. For many older adults, this can translate into less heaviness in the legs, better warmth in the feet, and an overall lighter feeling when moving. The key is how you use it. Flaxseed oil is sensitive to heat, so it should always be used cold. You can take a small amount directly or mix it into foods like yogurt or a simple salad. Stored properly and used consistently, it becomes a quiet but powerful support for your circulation. Now let's bring everything together in a simple routine you can actually follow without feeling overwhelmed. Because information only helps if it turns into something you can do consistently. Start with your morning. This is where you combine two of the most important oils we talked about. A small amount of extra virgin olive oil with your breakfast, along with fish oil. It can be a capsule or a portion of fatty fish. What matters is that both are present. This combination helps your blood vessels open more easily while also calming the irritation inside them. It sets a strong foundation for the rest of your day. Then, sometime during the day, add flaxseed oil. You can take it on its own or mix it into a simple meal. This supports smoother blood flow by helping your blood move with less resistance. At the same time, include black seed oil as part of your daily routine. A measured amount, taken regularly, adds another layer of support by working on multiple aspects of circulation at once. And finally, in the evening, take a few minutes for your legs. Apply castor oil and gently massage from your feet upward toward your knees. Slow, steady movements, no rush. This helps guide blood back toward your heart and supports circulation where you feel it the most. This routine does not replace medical care, but it gives your body consistent support in the areas that matter most for healthy blood flow. Now, before you try to do everything at once, let me share something that can make this much easier for you. You do not need to change your entire routine overnight. In fact, trying to do too much at once is one of the main reasons people stop after a few days. It feels like too many steps, too many things to remember. What really works is starting small and staying consistent. For example, you might begin with just one simple change. Add a small amount of extra virgin olive oil to your meals each day. That alone already supports how your blood vessels open and respond. Or you might start with the evening routine. Take a few minutes before bed to gently massage your legs with castor oil. This can quickly help you feel a difference in warmth and comfort. The key idea is this: one habit done every day is far more powerful than 5 habits done once and forgotten. As your body begins to respond, you can slowly add the other elements. Maybe after a week, you include fish oil in the morning. Then later, you introduce flaxseed oil. There is no rush. Your body has taken years to reach this point. Giving it steady, daily support is what allows real change to happen. Keep it simple. Keep it consistent. That is where the results begin. Before we finish, I want you to pause for a moment and think about your own body. What brought you here today? Was it the heaviness in your legs that seems to show up earlier than it used to? Was it that constant cold feeling in your feet? Or maybe that slight dizziness when you stand up too quickly? Whatever it is, don't ignore it. These are not random changes. They are signals. And the good news is, your body is still able to respond when you give it the right kind of support. You don't have to be perfect. You don't have to follow everything at once. Just choose one place to begin. Maybe you start with your morning. Maybe you start with your evening routine. What matters is that you begin. And if this conversation has helped you see your symptoms in a new way, stay connected. There's a lot more we can explore together about how your body works after 60 and how to support it in a simple, practical way. If you know someone who struggles with heavy legs or poor circulation, share this with them. It might be exactly what they need to hear. And one last thing. If you are managing conditions like diabetes, kidney problems, or taking medications that affect your blood, take a moment to speak with your doctor before adding new supplements. It's a small step that makes a big difference. Your circulation is not decided by age alone. With the right daily signals, your body can still move toward better balance. I'll see you in the next one.